Let's turn our attention now to health concerns. The Nigeria Center for Disease Control and Prevention has reported 822 confirmed cases of Lassa fever and 155 deaths this year alone. The agency also mentioned that 21 states recorded at least one confirmed case across 105 local government areas. The NCDC published its Lassa fever situation report for week 28, confirming 11 new confirmed cases in Ondo, Edo, and Benue states. According to the NCDC, 89% of confirmed cases are from 5 states: Ondo, Bauchi, Edo, Taraba, and Ebonyi states. The center says it has implemented the Lassa fever environmental response campaign in high-burden states, but late presentation of cases is leading to an increase in fatality rate. Let's bring in Associate Professor of Infectious Disease, Molecular Virology and Genomics, Department of Microbiology in Adeleke University, Professor Oladipo Kolawole. Thank you for joining us on the news this hour. Precisely, what do you think is happening here? Year in, year out, we seem to continue to battle this challenge. Why are we not making any advancement in this part of the world, in specifically where Lassa fever is concerned?
Well, it's not a new thing. Lassa fever is actually endemic, and one of the states of high burden is Edo, Ondo, Ebonyi, Bauchi, Taraba. So this is something that we see yearly. So what I can say that is a concern is what is the level of our preparedness as a country, as an individual, towards this kind of ailment that is endemic in Nigeria. And also, I think we need to put in more efforts into community sensitization. We need to put in more efforts into our research and development, because we are sure that this is transmitted from animal to human, human to human. So once we have this understanding all this while, our level of preparedness needs to be more higher than what we had in previous years. So I think we need to work more on ourselves, work more on this community, work more on the facilities that we have. Then the public health aspect of this work needed to put in more funding into it. Community sensitization, putting a lot of measures in place. Honestly, we should not be talking about it anymore, because we are talking about rodent control. We should be talking about community awareness. We'll be talking about a good surveillance system, not until we have such a case. We'll now be running from pillar to post, because we already have data showing us that these are endemic regions. So more resources needed to be pushed to the endemic region that we have in Nigeria.
From a science perspective, are we anywhere close to a vaccine or faster diagnosis? Because NCDC is saying these illnesses are not presented early enough, and that's why we're recording fatalities.
Well, it can be said so, but beyond that, it's a viral pathogen. So there could be a tendency for us to have a better understanding of the genomic composition of the current strain that is causing deaths in the country. But when we talk about vaccine, a lot of study has been done in vaccine research. And up to now, there is no exactly licensed vaccine for these Lassa fever virus. So what we need to do is that there are some clinical trials ongoing as funded by CEPI and as reported by WHO. But yet now, there is no vaccine for use. So what we have to do more is to talk about rodent prevention, eradication, community sensitization, and enhance our laboratories for quick and early diagnostics. Because if we can have people going to the clinic as at when due, it will be easier for us to diagnose early. And like I said, the Nigerian government need to rise up, put in more fund into the research and development of Lassa fever vaccine, so that we can have something to use to save the population.
Absolutely good place to live. The Associate Professor of Infectious Disease at the Adeleke University, Professor Oladipo Kolawole, thank you for talking to us.
Thank you for having me.